about us.
Hello, hello. All right, I believe we are live everywhere. I am double checking. I got a couple people in here with me. See Debbie from Australia. Love this question, Debbie. Roel, what's going on? We'll let a few people come in here. Thank you guys for hanging out on the Performance Medicine Show, our live Q&A we do every single Tuesday night. If you're new here, let me know where you're from. If you're here with us every week, say hello. See everybody over there on Instagram. I see you, KD Fish, Lisa Sterling, A Cuff Joy, Pam, Tinkin Winkin. Love the Instagram family. Hope everyone is doing well. Connecticut, I see. I like that. I got some friends from Connecticut. Whereabouts in Connecticut? I was actually just in New York City this past week. Frida, what's up? Carter, happy Tuesday to you. Can't wait. We're going to get to chat tomorrow. I'm looking forward to this. Tom, what's up? It's been a wild weather day in East Tennessee. Lots of rain. That's right. Thank you, Carter. I will be asking for score updates. The Vols are playing right now. Kentucky, I believe at Kentucky. Go Big Orange is right. We'll need to get some score updates throughout the episode. Real quick, did anybody with me live, did any of you watch the episode today that went out this morning on the Common Sense MD with Dr. Denise Sibley? If so, let me know. We're wanting to, one, that the video was, obviously it's around a controversial subject. But I thought both Dr. Rogers and Dr. Sibley did such a great job of explaining, their experience. So let me know what you thought. And there's also an adjacent article, as you know, on performancemedicine.net. You could check out if you want to read kind of the highlights from the episode. But I'd encourage everybody to watch the full thing over on YouTube or Apple or Spotify, all the content places. Oliver, I like that question. Thank you. Thank you, Roel. Yes, cool. That's awesome, Carter. So Bency liked it also? Oh, thank you, Donna. Yeah, great question around osteopenia. Andy's going to knock that out of the ballpark. Lisa, how you doing? Are you feeling okay? Let us know that you're home. Let us know you're doing well. Thank you, Emily. Thank you for listening. We also had another video that went out with nutrition coach Lucas Schmidt. I believe that was on, if I can find it. Let's see, where was that? Oh, this was fun. Thank you, Lucas, for doing this with me. Talking about how to increase the amount of protein in some of our favorite baked items. We even get into like protein pancakes. We get into all this fun stuff. So thank you, Lucas, for enlightening us with that episode of Dive Into Diet. And there's Dr. Denise right there over the the controversial topic. But it was one that, we've wanted to talk more about. And at the end of tonight, I'll kind of let you guys know what we're cooking up for next week, which will be another really fun episode. Lisa, I'm praying for you. I'm praying for you. I hope you're okay. We'll be sending up prayers for you tonight during the show. I agree. I agree, Tom. Yeah, it's yeah, I think that's right. Yes, Roel. Doc can't do a high kick. I was shocked as well. I actually filmed that one. Oh, thank you, Frida. I'm glad you said that. So there's two with Dr. Sibley. Honestly, watch both of them because, talk about two doctors who were kind of in the, just in it. So I think I think Dr. Sibley treated over 8,000 people over the last 5 years for COVID. Yeah. Ivy and JC with Ivy. What's going on? Thank you. I did. It was awesome. It was awesome. It was a wonderful, wonderful day. I got to celebrate with you guys last week as well on the show. Thank you guys for being with me. Let's see. I'm going to make sure Andy's going to be with us tonight. He's going to answer all your questions. I'm going to make sure he has the link. Steve, I love you, brother. I love you. I'm thinking about you. Let's see. Andy's asking for the link, and I believe I sent it to his email. Okay. Andy's on his way. Thank you, Carter. Interesting. The first was your favorite. Yeah, I'll be interested in what people, connect to most. The first or the second one with Dr. Sibley. Again, you can find those on the YouTube channel, as well as the Common Sense MD podcast on Apple and Spotify. Thank you, Steve. Let's see here. One thing I want to put back up. We got a few people in here. This is happening in our Johnson City Clinic, March 27th and 28th, Thursday into Friday, with Rebecca there, breast thermography. If you have any questions around that, Andy's a great person to ask about it. He's talked with Rebecca quite a bit about thermography. So ask away. That's happening here in a couple, a month or so, a little over a month. All right. Andrew, ready to roll?
Yo, what's going on, bro?
How are you?
I'm good, bro. Hey, looking good. Look at that hair.
I gelled it.
Dude, you do look good. We just need a little volume. That's it. Just a little volume. You look really, really good.
What do you suggest for volume? Happy, healthy?
Yes. Only happy, healthy. Two, a nice volumizer would look good. Like a little, what did the young people say? Mousse.
A little mousse. I got a little mousse, but I do think it kind of weighed it down a little bit.
Oh yeah.
So it is what it is.
Oh, totally. No, you look good, and also too another thing too.
I love this texture spray.
Texture spray is good.
Yeah.
People say sea salt spray, like salt. You can actually salt it. Ben and I have the same stylist.
We do.
We go to Jonathan.
Yep.
Thank God.
Yep. Yep.
And so some of it, just deals with like the tease it. Ivy, quit teasing me, Ivy. Okay, I'm just kidding. Rowell in the house. What's up? What's cracking? Oh, Steve. Yeah, and Katie said texture spray. Put that one up there, Ben. Yeah,
there we
texture spray is good. Texture spray is good. The girls, Katie and Carter, have great hair. They have great hair.
Yeah, Connie Lynn back.
Connie Lynn. Oh,
thank you for being here.
Missed you. Connie, it's good to see you. Connie, I thought about you during the holiday season whenever I was sprucing up my wardrobe. And I thought about you because Connie knows all the things to do for the wardrobe.
I love it. I love it. Thank you guys for being with us tonight.
Ben's getting a haircut Thursday. Have you told him that?
No.
Yes. Ben is getting married in 3 weeks, and we're getting a haircut.
Yes. We're getting a haircut Thursday. Got a lot of research to do on what I want to do with it, because I like it long, to be honest with you. I kind of dig this.
Ben, yes, absolutely. I think it looks good. I think we just need a little bit more on top. Linda Jenkins, I keep driving around Kingsport hoping that I randomly see you. You know it, because we randomly ran into each other like 3 times, and so I keep trying to find you. And
guys, if you guys have a question for Andy, we're going to be answering all hour. Andy, are you ready to roll? Are you ready to rock this?
Ben, I was born ready. I was born nearly 3 years and 2 weeks after you.
Yes.
Born ready to answer your questions.
Your birthday is coming up, brother, and I'm looking forward to celebrating.
You just did yours.
Yep, I did.
I'm just telling you.
We had a great time.
Yeah.
All right. If you got a question for Ange, go ahead and put in the comments. I am going to start with a couple of questions that came in throughout the week. Thank you to all who send us emails with questions for the show. Real quick, we are going to do a special for the live people with us tonight. live around our vitamin store. It's going to be for free shipping tonight. If those of you are interested in getting some free shipping, it's going to be available tonight and tonight only for the people with us live. And I'll put up the code here shortly. Let me know if you're interested. Again, that is performancemedicine.net/shop, and I'll put the coupon code up here shortly. Let's start with this one, Ange. What are your thoughts on Lyrica for arthritis and fibromyalgia?
Oh, yeah. Okay, so Lyrica is also, well, I have a lot of thoughts on this. Lyrica is meant for fibromyalgia. It's a treatment that's actually an FDA approved treatment that you can use for it. It's one of the only ones. It's called pregabalin. The mechanism of action, so the idea behind Lyrica is that it reduces calcium coming into a cell, and so it decreases the excitement. Calcium can kind of excite a cell, so it decreases the excitement, which then subsequently decreases the decrease of neurotransmitters. So we're looking at norepinephrine, serotonin, dopamine. It can decrease that. So with fibromyalgia, I'm going to take that one first and then arthritis, because there's two different types of arthritis. Fibromyalgia is an increased sensitivity to pain. So the idea behind fibromyalgia is that there's actually an increase of substance P so that patients feel pain more. I don't know. There's not a ton of fibromyalgia kind of gets put in the kind of iffy gray category because there's not a lot of data to support it that says, hi, I have low T, so now my T should be 900 and it's 300, therefore I need to give T to get it up. The data point's a little bit different. So it's a little bit more in the I feel pain more than others, and not I have a data point that supports it. There is some evidence with muscle biopsies which show a little bit more increase of substance P, which deals with pain. So the idea is that you have to get creative in how you treat it. So there's different things that is more subjective rather than objective. So whenever we look at subjective treatment, it's almost like I think, therefore I am. I give you something as a provider and you feel different. Not necessarily you see a different data point. Does that make sense with subjective information rather than objective information of I see a healed bone fracture that's now healed on an x-ray and I can see it before and after. So that's really, when we're dealing with fibromyalgia, that's what we're dealing with. And so you have to get creative. So Lyrica is one that decreases the excitement of a cell, which finds a decrease in pain receptors where it can help out with fibromyalgia. I think it's a fine treatment. There's some downsides to it. It's usually, sometimes it doesn't work that well. Sometimes too, I believe there can be some like sleepiness. I think some patients have said that, or maybe an expense of the drug. I'm a big low dose naltrexone fan. That's my big thing for fibromyalgia. It decreases the inflammatory response of autoimmune illness. So it works on interleukins. I've talked about it 1,000 times. Works on interleukins and toll-like receptors, decreasing the inflammatory cascade, which can then improve pain receptors. It also increases endogenous opioid release. So whenever I think about anything that's going to deal with a mechanism of action, I like to go to the root source. And if we're having a root source of increased inflammation, decreasing that inflammation with a product like low-dose naltrexone is a preference. But Lyrica, absolutely, I would try it for fibromyalgia. Arthritis is different. So there's osteoarthritis and rheumatoid arthritis. Rheumatoid arthritis is really dealing with the synovial fluid surrounding the joints. And then osteoarthritis is in the word. It deals with the bone. So you think about bone on bone. So you'll actually see differences in x-rays between the two. And then too, rheumatoid arthritis has an autoimmune component, which will have a data or a lab value associated with it. Not my favorite thing to use for arthritis would be Lyrica. I would then again use low-dose naltrexone. I would work on nutrition that could deal with arthritis. Actually, there can be some PT that does with arthritis. They say with osteo versus rheumatoid arthritis that the less you move, the more rheumatoid arthritis hurts. The more you move, with osteoarthritis, it's almost like you wake up with stiff bones. I think it's actually rheumatoid arthritis. The more you move, the more it hurts. Osteoarthritis, the more you move, the less it hurts. So some of it can actually deal with like what's like movement can actually work better. I'm an LDN person and a nutrition change for both of these. But Lyrica, I would say yes for fibromyalgia, no for arthritis.
I
That
love
was a
this
long-winded. That was a long-winded answer. But Lyrica, I do think it's interesting though. It is FDA approved. And I actually just saw one of the comments in there too. Hydroxychloroquine. Yeah, absolutely. It's great
Yeah.
for rheumatoid arthritis and really great because that's within the autoimmune cascade. Hydroxychloroquine and ivermectin, some of those novel drugs that are anti-malarial or anti-parasitic, those do kind of deal with the same thing that Lyrica does with decreasing calcium or potassium exchange into a cell, which can de-excite a cell. So I love it. It's at little cost to your body, which I love. I love anything that's at low cost to your actual body and the way it works. It's a no-brainer. I would say if I'm trying them, I try low-dose naltrexone, then hydroxychloroquine, which too can have some interesting things happens to your eyesight. They recommend having a fundoscopic exam prior to. There's some evidence too of it can discoloring your skin. It can make you have gray skin with hydroxychloroquine. It's not all the time, but that's like the really weird things that happen with it. Then I would go for Lyrica after that.
Such a great question. If anybody in here live has had success with arthritis or fibro, let us know what you're doing. Real quick, I see Amr Knox in over there on Instagram. Did I miss the first part of that question, Amr Knox? I see the second question, I believe, which I love. Let me know if there's a first part I'm missing. I see McLeod Organics is in here. Love you guys. Thank you for being with us tonight. Okay, let's go to the next one here. And I think someone had a UTI question as well in the comments. I currently have a UTI and started taking Bactrim. What is the best way to avoid a yeast infection from the antibiotics? Will taking Digest Shield feed the bad bacteria, or is it safe? So there's a couple different questions here.
That's a great one.
That's
a great one. Okay, I like to break things down. UTI, urinary tract infection. So we're getting an infection of the urinary tract. More common in females than it is in male because the urinary tract is much smaller. And two, it's the mechanism of how the genitalia works. With female genitalia, it's much more susceptible because everything is right there and can get infected very quickly. Same way with males, but really it's UTIs are very, very rare in males. You really have to do a deep dive. I've had it happen one time and it was a very interesting case. So with UTIs, super common with females and also super common too with taking antibiotics. Antibiotics it fights bacteria. It can also kill good bacteria. So whenever you're doing good antibiotic treatment, it can decrease. Sorry, I'm getting a bunch of notifications. Hold on. Can you still hear me?
I got you. I can still hear you.
Can you hear all the notifications I'm getting on my computer right now?
No.
Oh my God. It's like, it's going off like, okay, thank God. It was like dinging in my ear. Dinging. Sorry, like I don't turn on this computer. I usually use my iPad a lot, so sorry about that. UTI, urinary tract infection, more common in females than men. On the mechanism is really the genitalia and how long that urinary tract is and what it's close to. When you take an antibiotic, which is Bactrim, and the three most common antibiotics for UTIs are first Macrobid, second Bactrim, which is a sulfa drug, and then Cipro. We're getting away from Cipro because it can actually have some long-term side effects with tendon rupture. Those are the three most common antibiotics using. And really, the thing is, antibiotic kills bacteria. So what is the best way to avoiding yeast infection? Yeast can grow when you decrease bacteria to fight off the yeast. So it's important too that anytime I usually write an antibiotic for a UTI, which in my opinion should be available over the counter, UTIs, you got to catch them early and they can turn into pyelonephritis. It can hurt your kidneys if you don't treat it. So often women have to kind of go for the rigmarole to get an antibiotic for it. I just feel like it should be over the counter. You don't want to You don't want to misuse those though, because it can really kill off the flora and you can become resistant to it. So there's a little bit of a catch-22 there. But yeast can overgrow because you kill bacteria. So you want to kill the yeast if yeast can overgrow. The best way to avoid it is just honestly concomitantly or taking at the same time an anti-yeast. It's usually diflucan 150 by mouth. You take it on day 1 and you can repeat day 2 if symptoms continue. Yeast is usually pathognomonic, or like the symptom is that you get kind of a yeast smell and a discharge that comes along with it. It's a pretty specific discharge. So I usually say if you take an antibiotic, take diflucan with it if you have to go that route. Or if you're looking at a natural route or an over-the-counter route, or as opposed to an antibiotic, Digest Shield, that is a product that is a probiotic, a prebiotic, and a digestive enzyme. That's a great tool. It will not feed the bad bacteria. It's super safe to take. It's going to feed good bacteria and give you bacteria. It's not super specific to vaginal bacteria as it is gut bacteria. So every microbiome, the skin, everything that protects you from the outside world has a microbiome. So you have all this bacteria that's supposed to live symbiotically with you. It feeds off you, but also protects you against good stuff. That's a symbiotic relationship, not a parasitic relationship. A parasite only feeds off you and you get nothing from it. There's a great movie on that called Parasite. So symbiosis is takes from you, but also gives to you as well. That's what the bacteria and the microbiome does. There's microbiome on your skin. There's some in your gut, but there's also no vaginal flora. There's a really good product called Garden of Eden it's women's health probiotic, and it is specific bacteria. And there's one specific, and I can't remember the name, bacteria that lives in the vaginal flora. Remember, that is bacteria that is open to the world that needs to protect you from the outside world. So that's why it's particularly in there. And so I would say Digest Shield is great, won't hurt. Garden of Eden women's health or women's probiotic is a little bit more specific to it. And 2 other things that you can do to treat UTIs, you can do D-mannose. D-mannose is an over-the-counter supplement that helps support the gut or the vaginal flora and can help prevent or decrease UTIs, or actually kill off bacteria, because it's increasing the good vaginal bacteria. Methylene blue is also great, but just because it's antiviral and works against, yes, methylene blue, it's great. And 2, you've got to really increase the doses on methylene blue if you're using it for UTI. So you'd use it for active infection. I would say upwards of, there's a particular milligram per kilogram, but I would say go upwards of like 45 milligrams for a couple days. Okay. Ben loves that methylene blue, baby.
Love that blue. Love the blue, the NeuroPro Plus.
So I would say methylene blue, D-mannose, Garden of Eden. It's either Garden of Eden or Garden of Life. Women's Health Probiotic is another way to treat it. But if you're going to do it through antibiotics, Bactrim plus diflucan 150. It was a long-winded answer, but gosh, women have to go through crap to get through that. You should be able to do everything you can to avoid it, because it can just wreak havoc.
It's such a great question, and one that I hope is helping quite a few people in here. I see Laura Stifler on Instagram. Laura, thank you so much.
Tell her Laura, listen, we have a lot to talk about. Text me.
Laura is saying D-mannose.
Will you tell her? Can she see me? Is this live on Instagram?
Laura, can you see Andy? I can't. I can't
see. Well, I can't see Instagram. Okay?
I know.
Laura knows I'm anti-social media. She knows it. So we're all Oak Ridgers by nature. I love Laura. I love her whole family. So we're all show kids, and Ben wasn't a show kid. Ben didn't have the face.
I am an Oak Ridger though. I am an Oak.
He's an Oak Ridger. Ben was voted. I just want to let everyone here know that Ben was voted most athletic in the 8th grade. Were you most athletic in the 8th grade?
I do think it was the 8th grade. Yes.
Ben was a baller in the 8th grade. Baller. I peaked much later. Ben, you didn't peak in the 8th grade, but God, you hit a really good high note in the 8th grade.
Now, let's be honest. Middle school was my peak athletic years.
Ben was like the Justin Bieber during the baby time. Like he was. Go Eagles. I just want to say go Eagles and go Wildcats.
There we go. There we go. I see a question. There we go. Around ivermectin. I see you. Let's see here. Tracy, what's going on?
Tracy in the I see it here because I can see these comments.
You can see Facebook.
Tracy in the house.
All
Mark
right.
Milford in the house. I love Mark. Oh my God, love him.
So this is a great one, and one, we've talked a lot about this over the last month or two. Question is a Z-Pak and ivermectin an effective treatment for the flu? What's your thoughts on this one? And and we'll go from there.
Okay, here's my real thoughts.
Yeah.
Like, no, I would say not really effective. Although I think you can throw a Z-Pak and an ivermectin at a lot of things and it can work. But technically, it's not anti-flu. So Z-Pak, it's a macrolide and it's an antibiotic. It has an anti-inflammatory component to it. So you might get a little bit of relief because flu can make you feel under the weather and make you susceptible to secondary bacterial infections or secondary viral infections. It's not going to really kill off the flu. However, a Z-Pak can decrease the inflammatory response caused by flu and make you feel better, or kill off a secondary bacterial infection. Ivermectin. Ivermectin is technically an anti-parasitic drug. It's been repurposed. It was originally designed, and everyone knows this on here because we've talked about it 1,000 times, and it's now recognized by the World Health Organization as a treatment for COVID. So it is out there. Ivermectin technically was for river blindness in Africa, won the Nobel Peace Prize. It's either in the 70s or 80s, might have been 70s maybe. And they're repurposing it for COVID because it doesn't allow, it prevents, I think it's a calcium channel blockade where the virus can't come into the cell and replicate. So that's how they used it for COVID. It's kind of an ace in the hole, magic bullet, can work for a lot of things without it necessarily hurting the body. So it's one of those things that's kind of a no harm, no foul, and a particular milligram per kilogram. The only negative I've seen is it can kind of actually affect vision if the dose is too high or the patient's too sensitive to it. It's not technically anti-flu though. So I would say for both of these, it wouldn't hurt to do it. It definitely wouldn't hurt, but it's not going to be anti-flu. Tamiflu and Xofluza, those are the ones that are actually specific to flu. If it were me, just my personal opinion, I think yes, if you get flu, test positive for flu, someone in your family has flu and you get symptomatic, take Tamiflu. Just do it. And I would say those would be more helpful than Z-Pak and ivermectin. However, neither of those are going to hurt if you're just like, I want to kill anything because I'm around a lot of sickness. Ivermectin is amazing. I take it twice a week. I just keep it in there. I do that with methylene blue. And if I feel the slightest tingle in my throat, I triple the methylene blue right off the bat. And I take 15 milligrams a day.
How many?
Easily 15.
Oh, 15 of methylene blue.
Okay. That's just what I do. That's how I feel. I feel good with it. And I'll triple it if I used to like take a much lower dose and double it. But now I take 15 and triple it if I feel the slightest tingle and it's gone in a day or two. So that's how I stave sickness away. But sometimes you can't help it if you got flu. So I would say no. The answer to this is no, not specific to flu. It won't hurt if you do take it, but the mechanism is for secondary infection. And an anti-inflammatory process. It's an anti-inflammatory process to feeling sick. But look for Tamiflu, and you got to take it within the first 48 hours of flu. Flu A is going around. It's really going around. Ben, I'm surprised and shocked you don't have it. Look at that face. Just kidding. I'm just kidding. Ben doesn't want the flu. Okay, don't give it to him.
No, I don't want.
We took a lot of methylene blue in New York. Ben and I just came back from snow in New York, celebrating his bachelor party.
Yep. Man, we got some cool pictures. We did. We saw it snow on that snowy night. All right, guys. That does it for the questions that came in throughout the week. Thank you guys for sending those. And real quick, I'm going to put this up here for those who were with us earlier. Live Q is the coupon to get you free shipping tonight. That'll go on. We'll keep it on the rest of the evening, just so I know not everyone's going to go over there and to the store right now, which I hope you stay with us right here. Live Q is the coupon. So if you want to take advantage of free shipping, you can do that with that code. I'll be putting that up throughout the evening. We're going to go to live questions here on Instagram. I'm looking at you guys too. If you have a question for Andy, go ahead and put in the comments. I see Amor Knox has one. Let's see here. Where are we at? I see Tink and Winkin. I got you. We're going to start over on YouTube here for Debbie. It's Wednesday morning for her over there in Australia. The question is, how do you manage your diabetes on long haul flights? So,
oh, Debbie, I'm so glad we're type 1 buddies now. You and me, girl. Okay. We're in it to win it. So this is a great question. I actually traveled for, I don't know if you remember this, Ben, when I did Up with People.
Yep.
So I traveled for 6 months. I didn't go home for 6 months. I was 19 and I was on a pump. So I had to find ways to get insulin pumped, and we traveled all over the world. So I traveled to Taiwan. I was there for a month or two, a tiny bit in Mexico, Bermuda, but mainly in the United States. So I was lucky because we were mainly in the US. So I had to find creative ways to do that. So traveling, a lot of it is like, how do you keep insulin cool? Insulin technically needs to stay cool until it's in use and you pop that vial or pop that Flex Touch pin. So the question is, how do you manage diabetes on long haul flights and tips on jet lag? So I always carry stuff for lows, and I don't carry liquid because the liquid thing's weird with traveling. So I'm usually gummies, or which isn't like totally kosher with the all natural thing, but I do an organic Annie's gummies and glucose tablets, which have preservative. It's not the cleanest, but it's something to keep blood sugar up. Diabetes on long haul flights too. A lot of it is just making sure you have food with you. I do something different. I always do stuff for my veins because as type 1s, we can have some vascular insufficiency. So I always do compression stockings. So I do long haul flights. I'm always doing compression stockings. I'm taking omegas for sure to keep blood thin. I used to do aspirin, but I actually got a little bit too thin, and I got a little bit of like increased pooling of blood and bruising. But a lot of it too is just, to me, honestly, Debbie, it's keeping food with you, just so that you make sure you don't get low. And then two, I'm a Dexcom G7 guy, and it's right on my phone. And there's ways that you can still get readings while still staying in airplane mode. And then you can even do some tip basals if you find that you run high or low. If the stress at the flight makes you run high, you can increase your basal by 10 to 20%. Or two, just kind of saying, hey, I'm going to enjoy myself on this flight and forget it if I run a little bit high, but you'd rather run high than low on a flight. Tips for jet lag is going with the time of day. And I'd say that's with or without diabetes, that if you're going to, like flying to Europe last year, you kind of fly at 5 or 6 and then you fall asleep on the flight and wake up the next day, stay up the entire next day, and it'll kind of help your body regulate. I'd say too, there might be more specific questions on how you take your Tresiba. If you take a long acting insulin, you'll have to time it. And I would say too, it's better to have Tresiba than Lantus. I know that's probably anti-company, whatever. Tresiba, you can actually skip a dose. So technically the duration of action of Tresiba with that long-acting insulin is 42 hours. It's 42 hours. So you can technically take it every other day and your blood sugars will stay normal. So I'd say if you're on basal bolus, get on Tresiba. That way, if you skip an injection and want to get back on the next day, then that's going to be easy for you. Did that help, Debbie? If you have specific questions about your care and like if you're traveling, I'd love to answer those. Any type 1s I'm all about. So like if Ben, if somehow you can arrange that so she can get in touch with me, I'd love to help you out. Toujeo. Is that might be Lantus. Hold on. I think that's the new version of insulin glargine. That's Lantus. So Toujeo is Lantus, and that's a 24-hour. That's typically 24 hours. You'll still be fine with that. I just prefer Tresiba, insulin degludec instead of insulin glargine, because it doesn't. The way that Lantus and Toujeo works, it's in a pH dependent. It leaves a little depot. And then the acidity of the body and the existential fluid that it goes into in the subcutaneous tissue, that's how it moves throughout your body. Levemir and degludec's a little bit different because it attaches to cells differently and degrades more slowly, but not in an acidic pH environment. I would say if you can switch to Tresiba, if you're about to go on a long flight, you're going to be fine. Just time it out to where I think it's better to run high than run low. So I would say time it out with your injections with Toujeo. And if you have specific questions, I can help you out and we'll make a plan.
Debbie, I hope that helps. Thank you so much.
Sorry if that was
in
piecemeal. I love talking about that stuff. Wear compression stockings.
All right, guys, as you can see there, I'm putting the free shipping code. I see a couple methylene blue questions. We have that on our store if you want to take advantage of the free shipping. The shipping code or the free shipping code is LiveQ, all in caps, and that'll be live the rest of the evening. We're going to go to Oliver here on YouTube. Thank you, Oliver. What helps best with shoulder pain? I know you've had elbow pain. Like I know you have thoughts on this. What's your thoughts?
I've had, it depends. This is a great question. It just depends on the etiology. Is this an injury? Is this arthritis? Is this just overuse, wear and tear, tendonitis? The shoulders tend to get a lot too. It's a very mobile. It's not just flexion, extension. There's rotation. You can go in and out. What I would say what best helps is that if you're sleeping on it, don't sleep on it. Because that's how I was getting a lot of shoulder pain. We're tennis players. I don't know if Ben told you, but he's a professional tennis player. And
Thanks,
two, we use a lot of that rotation like this. So it's a lot of wear and tear. I was also sleeping on it, getting a ton of shoulder pain. A lot of it was how I was carrying my posture. So I think a lot of it is building up the paraspinal muscles in your back so you actually carry that shoulder girdle better. Don't sleep on it, and actually sleep on it to where you're having a pillow over your body like this so that it gets a correct position while you sleep. I think a lot of shoulder pain probably comes from sleep. Two, if we're looking at over-the-counters to decrease the inflammatory response, curcumin, turmeric. We have a Dr. Rogers pain formula that has curcumin, turmeric in it. And some other naturals that decrease the inflammatory response. Low-dose naltrexone is great. PRP, platelet-rich plasma, that increases your own, it honestly like builds back the tools within your shoulder or your joints, your knee, your elbow, to help rebuild some of the cushion in there and collagen and strengthen that shoulder capsules. I'd say depends on the severity. I'd start with sleep hygiene first, the way you carry yourself, the way you exercise and hold your position of your shoulders. Second would be naturals and over-the-counters. You can use ibuprofen, which will be hard on kidneys over the long run. Tylenol is hard on the liver over the long run, but can be used short-term. Then looking at PRP as a more natural intra-articular mechanism for decreasing shoulder pain. Steroids would be the next. Very last would be shoulder replacement or partial replacement or arthroplasty within the capsule. I have a lot of friends that work in orthopedics. You will lose function of your shoulder if you do that. And that's, some people can't help it because the damage is so bad in there, but you will not be able to raise your shoulder past a certain point if you do surgery. So do everything you can before. Look at PRP if it's that bad.
Oliver, hope that helps. It's a great question. Let's get to Donna real quick. Hope you had a great day. I hope you had a great day, Donna.
Found out, I hope you had an amazing day. I do.
I recently found out I have osteopenia and was wondering what calcium is best to take, and is there something you can take for the calcium to absorb better? Great question.
That's good. So to osteopenia, for those who are not familiar, it's between having no bone disease, osteopenia, osteoporosis. So two, it's basically saying that you're not quite to osteoporosis where it's eating away at your bones and we're having decreased bone structure, but we're on the way there. So it's a mid-range diagnosis. So calcium is great for the bones. Vitamin D is even better for the bones, and estrogen's even better than that. So estrogen loves your bones. Vitamin D loves the bones because it can get calcium into the bones. And then calcium's part of the building blocks of what bony material is, what actually those cells, osteophytes, are made of. So calcium, I honestly, coming from food's going to be the best. There's a lot of controversy, and we have a video from Jill. She was our PA in Bristol that did orthopedics for 15 years and osteoporosis care for 15 years before coming to us. She has a great video that will explain the mechanisms of what calcium does for the bones and how you should get it. I believe her favorite's AquaCal. AquaCal, I believe, is the best version of it. I don't know that there's a better way to absorb calcium except getting it through nutrition. And I would say probably taking vitamin D with K2 is going to get calcium directed to the bones. So that would be the better way to absorb it. So my answer would be vitamin D with K2. Look at AquaCal if you're going to take. We used to recommend Bone Restore from Life Extension, which is probably still a good one, but AquaCal, I believe it's AquaCal. Let me look that up. AquaCal, something like that. AquaCal. I forget it. That's what it's made with. Oh my God, what is algae? Algae cow. That's what it is. Not AquaCal. Algae cow. It's made with algae, sea algae. That's what it is. That would be probably the best over the counter, or getting it through nutrition. Too, but really look at doing, if you're ready for estrogen. Estrogen's so good for the bones, or vitamin D. It's great.
Great question, Donna.
That's a
Thank
good
you so
question.
much. Yeah, great
And look at that
question.
video from Jill. I don't know if there's a way to put up that link, but Jill is a really good. If you go on our website and look in our search engine, Jill has a great video.
I'm trying to find what I'll do here is I'll find that video and put the link in the comments for you, Donna. And I do think it was just on osteoporosis in general. Is that right? If you search for
And
osteoporosis,
calcium. It was osteoporosis and definitely calcium.
okay. Okay, let's go to I saw a question here. Edna, did we answer the UTI question?
Oh, Edna. God love her. Edna's going to take care of all our kids when we have them.
I love it. I love it.
Mama Edna.
Okay, I'm seeing Lisa's question if I can find it. Lisa, here we go. Thank you, Lisa. I need to know how to better your liver health. I also need to know how to increase your calcium level and keep it up outside of taking oral calcium. What's your thoughts on this?
Oh, Lisa, it's so good to see you, Lisa, and thank you for this question. Calcium, I would say too, if you Google what is high in calcium, that's what's going to do it. Lucas used to have like a little list of the foods that were high in calcium, and that would be a way to take it outside of taking oral calcium. And I can't name them off the top of my head, but there is a list, and I believe Lucas made a list too of how best to get calcium intake. A lot of it too, if people do like milk, like that's rich in calcium. I need to know better about liver health. Liver has a lot of different functions too. It makes cholesterol. It filters a lot of things. It's a place to get rid of toxins. It makes a lot of blood and coagulation materials. The liver is super important. The big thing about supporting the liver is supporting the hepatocytes. So the things that we put through our body then get filtered through the liver. So they call that first pass. So if you have something go through your body, whether it's usually through medications is what we're thinking of, it can get metabolized through the liver and sometimes can cause damage to the liver. So what I like to do is milk thistle. Milk thistle is really good for liver health and can help rebuild hepatocytes. I'd be careful about the amount of medications that you take. It depends. There's a risk benefit. Sometimes you just have to be on stuff. But if you can cut down on that list and do a medication reconciliation and decrease it, that'll help with your liver health. Water can help with your liver health. Stress, de-stress can help with your liver health, but really anything like milk thistle is really good. Dandelion roots also really good for your liver too. That's part of a lot of liver detox and liver support. And some people do a detox for their body and do parasite cleanses. That can also help. But I apologize that I don't have the exact list of natural calcium support. But I know that list is available. It's a Googleable list. And a lot of it's going to be eating natural foods. Natural foods are going to increase the foods that were meant to be on the earth are going to increase the things that you need for your body, both micro and macronutrient.
Great question, Lisa. Thank you so much for that. I'm going to go to Instagram real quick. I got a couple over there. I can't put these on the screen, so Andrew, I'm just going to read them out for you. Elmer Knox is asking, does pineapple juice actually help with inflammatory properties?
Yes. Bromelain. Bromelain is the component of pineapples that do that. Pineapple juice, you want to be careful about, like, there's a part from Mean Girls. She's like, I'm only going to drink, is it cherry juice or like cranberry juice? I'm only drinking cranberry juice. It's a cranberry juice diet. He's like, this is cranberry juice, not extract. It's cranberry juice cocktail. It's just sugar. She's like, I really want to lose 3 pounds. It's like, make sure that the pineapple juice isn't like a really sugary version of it, and that it's actually just the juice from a pineapple, because that makes a big difference. But bromelain is a component of it. And I'm actually taking bromelain separately in a capsule.
Thank you, Onward Knox.
That's a great one. That's legit. That is legit science. Yes. I don't know how much pineapple juice you'd have to do to make a difference, but I do know that that's super legit.
Thank you, Ange. Great answer there. Thank you, Amr Knox. This is from Tinkin Winkin on Instagram. I'm 59, and for a long time I'm getting a lot of bloating. Not sure how to get rid of it or help me feel better. So this seems just kind of a question around feeling bloated all the time. Any thoughts on this? I don't think I'm missing the question there. Or
I can like to a lot of that with dealing with bloating. I always say like, hey, let's look at the big clinical picture. 59, maybe we're in menopause, and suboptimal hormones can cause bloat. So too, and a lot of it is estrogenic, because estrogen keeps fat where it needs to be, kind of in the hips and in the breast tissue, and then it all kind of accumulates in the midsection. So some of it might be hormonal imbalance, or it could be gut imbalance and microbiome imbalance. So if you're two, it could also be nutrition led. So if you're having a lot of abnormal growth or undergrowth of the normal microbiome in your gut, it can release things that cause bloat. So sometimes if it's what you're eating, and I feel bloated after eating a certain thing and it looks like I'm 20 weeks pregnant, that's probably more gut related than I feel like I have abdominal fat that won't go away. That's probably more hormonal. So I would say look into hormones or look into gut health, depending on that. If it's I feel bloated after eating, go for the gut. If it's I always feel bloated and it's just sitting there, go with hormones or go with both.
All right. Thank you for that question over there on Instagram. I'm looking at you guys. If y'all have a question for Ange, go ahead and put in the comments. Let's get to, let's see, Karen over here on Facebook. Thank you, Karen. Best collagen for skin. Is there such a beast for crepey, I hate to say wrinkled skin, especially at arms, thighs, also grams of protein? A woman who exercises 5 to 6 times a week should have in a day. So I think, so we're talking about best collagen for skin, and then we'll get to the amount of protein that you're often talking about for women who exercise a lot. Thoughts on this?
You definitely need a lot more protein than the average female. I can get an exact number from Lucas because he had one, and I don't know because it's a lot more than we think.
Yeah,
I think it's definitely over 100 grams, and I can get an exact number, but I'm pretty sure it's going to be over 100 grams. Technically, what we want to do is calculate BMR, basal metabolic rate, and total daily energy expenditure. See how much muscle you have in relationship to that through an in-body scan. And then you can calculate how much protein you need to build that muscle. And I think it's going to be over 100 grams of protein. It's going to be a ton of protein. And you have to calculate that with water too. And you should probably do some sort of creatine with it to make the protein absorb better into the muscles. So my general answer for that, for grams of protein, 5 to 6 times a week, should have in a day, I think at least over 100, definitely with water and creatine. Crepey skin. So what's best for crepey skin? So crepey skin is just, it loses all that beautiful hydration. I would say too, definitely incorporate a hyaluronic acid in with your collagen. Collagen that we use is usually keto collagen powder. It's a brand that we've carried at the office before. It's if you Google keto collagen powder, that's the one we've done.
Perfect Keto.
There's Perfect Keto. Yes, Perfect Keto. And then there's another one from Life Extension that are collagen gummies that really do work. You'll feel your hair, skin, and nails be better. However, my suggestion for you that if we want to really innervate the skin. So if we're at a certain age where we're getting wrinkled skin, arms, thighs, we want to innervate it. And the best way to innervate it is going to be through trauma. When you do trauma to the skin, it's going to tell your skin to rebuild into the matrix, into that SMAS layer, to where you make more building materials. And the way to do that's through needles. Needles are heat. So I would look at ultherapy. I would look at radiofrequency microneedling, either through Morpheus or through Virtue RF. And then two, there's something called the Evolve machine, so that can actually work on your arms and your thighs as well. So I think too, if it depends on the severity, you might want to have something that's actually treating at the source rather than through enteral or by mouth collagen. By mouth collagen, I would do the Perfect Keto collagen powder. I would do the Life Extension collagen gummies. I would target, if you can, this is all within reason, but here's everything you can do. Evolve machine or some sort of machine that uses heat and not cooling, but heat to stimulate collagen growth at this dermal layer, which would be an Evolve. And then 2, you can look at Ultherapy or radiofrequency microneedling, which delivers heat and heat through needles would be radiofrequency microneedling, or heat through ultrasound, which would be Ultherapy, to target the layers of the skin that increase collagen. And then 2, over 100 grams of protein at least, with a ton of water and creatine. I can get you, my encouragement is if you want exact macronutrient counts, get an appointment with Lucas and he will tell you. He's amazing. And Carter put on there tallow for the skin. Tallow is amazing. She's talking about beef tallow. Beef tallow can be made as a topical. The girls and I love beef tallow. We're all about it. There's a vanilla one that smells really good. The reason that beef tallow works is because when you're doing something that's dermal, like our transdermal, you want to find something that's very comparable to the human skin so that it actually gets absorbed and it doesn't sit on top of the skin like an emollient. So beef tallow has very similar ceramides to what the human body makes. So it's great.
Karen, thank you so much for that question. I see you on Instagram. That's so cool. Thank you, Karen, for that. And thank you, Carter, for the tallow there. I want to real quick. I see Frida. I'm going to get this one from Instagram real quick from Cozart. What is the best for dark spots on hands? We've talked a lot about this. This is a great question. What's your thoughts for this? Dark spots on hands.
Dark spots on hands. I would say too, you want to get it checked out. You want to make sure that a dark spot's not a melanoma. So like get that checked out first to see what type of dark spot it is. There's something called liver spots or age spots, which is the natural change in dermal layers on the surface that just deals with age, and aging of the skin. So 2, you want to make sure those dark spots aren't like blood pooling and bruising, because that can happen with age too. I would say get it checked out to make sure that it's not something nefarious. And then 2, you can do the same thing to retinols. Really help out with cell turnover. If you're trying to get rid of it, you want more cell turnover. You want the cells from the bottom of the skin layers to come to the top. And the way to do that is retinols or vitamin A. That will help get cell turnover going over. Sometimes too, you can laser those spots, and the lasers can decrease the brown spots or the dark spots because it kills those cells and they slough off. Sometimes too, 5-FU is a chemical burn to it, or a salicylic acid is another way you can do actually just dermal peels on your hands. So I'd say first get it checked out. Second, make sure that you have a retinol and you're using it for your face and your hands. If you don't treat your neck and your hands with your face, you're not treating your face. Absolutely. Ben, is that right? Are you treating your hands and your neck?
No.
You got to do here, here, and your hands, because that's where you tell aging is neck and hands. So I'd say definitely use a retinol. Then look at doing a laser treatment or a peel. Then I would look at 5-FU if you're just trying to slough off actinic keratosis or seborrheic keratosis.
Great question.
You want the idea behind that, the mechanism is cell turnover to come up.
I'm gonna put this up from Karen because please tell us you remember
Karen. How can I not? Oh my God, are you
please.
kidding me? Yes, no, absolutely. How could I forget? Karen, you need to come see me in the office. We need to hang out. Okay, we need to hang out. Where do I get tallow? We get it, and I believe Carter might have answered this too. We sell it in our Tri-Cities office. Lady May, it's a great brand. There's a really great person in Knoxville that makes it. Oh, Karen, yes. Come hang out with me in the office. Just fly on over. Come on.
Leanne, we do sell methylene blue, but it's in the NeuroPro Plus. So this is on our website, NeuroPro Plus. That's methylene blue in capsule form, and then there's a methylene blue we like on Amazon. I'm sure we can get a link to it, but it's the drops. Is there another way you'd answer that, Ange?
Oh, yeah, absolutely. Drops or pills. I like the tabs better. I really do.
All right. Thank you, Leanne. Let's get to Roel, and then we'll get to Frida there. If I'm taking 50 milligrams of zinc daily, should I supplement with copper?
That's a good question. I think zinc with copper is good. I don't think 50 is enough to deplete it. I really don't. I think that you'll still have ample amount of copper. If you're on the safe side, do it. Absolutely. Because zinc can throw off copper. So I think taking them both is going to preemptively help you out if there's copper depletion. I don't think 50 is enough to do it, but 50 is a good dose. So I'd say yes, especially knowing you. I think you're on the forefront of feeling good. Do it.
All right, let's get to Wilma here. Should a person with leukemia not take krill oil or omegas?
No, I think you should. Yes, absolutely. So leukemia, we're looking at cancer of the blood, and omegas or krill oil can kind of thin out the blood, but they also have a lot of anti-inflammatory properties. I do not think that's contraindicated at all. I don't. Depends on what the treatment you're doing for leukemia would be. But really, no, I think that'd be fine. I do not see a contraindication.
This from Teresa here. What do you recommend for anxiety for a very young adult? This is a great question. Anxiety in young adults. What are you kind of coaching people with?
So two, there's a lot of different things that you can do for anxiety as a young adult. One, I mean, just truthfully, I would say get to the why, get to the etiology of why. I had a patient that came in a couple of days ago, and I can't tell you his like chief complaint, but he was very anxious about certain situations, and he wanted to know if it was hormonal, and his hormones were fine. They were fine, but could be better. And so some of it, we got deeper into it, and a lot of it was confidence. I was like, okay, where does that come from? And it's like, I feel a certain way about myself. And I was like, how do you talk to yourself? What's a running thought in your head? It's like, it's a lot of the, I am not enough, and I'm not good enough, and I'm not this, and I'm not what. And that is his cause of anxiety. And no pill is going to fix that. No pill will fix it. Pills will numb it, but they won't fix it. So I'd say, Teresa, this is a great question.
Yep.
Very young adult for anxiety is get to the root of where that is coming from. I would say absolutely a really good therapist is a good place to start, and not to have the stigma of therapy of, oh, go see a shrink and you need help. I think if this person gets down to the spiritual, not religious, but spiritual component of who they are as a person, that's not going to fix anxiety. They're going to know how to live with anxiety. So that's just a great thing to start with. If you're looking at stuff that's going to be over-the-counter naturals or prescription, I would look at the adaptogen class that decreases cortisol, which can make you feel less anxious. So that's saffron, L-theanine, ashwagandha. Then I would look at doing something that just calms the heart rate down, because then it can just calm your nerves down. That'd be propranolol, and that's very benign and so it doesn't have a lot of side effects. Then you want to look into doing something for the like serotonin. Serotonin looks at doing it just increases your mood and your feel good. Serotonin is a feel good. So that'd be the last step I do. But my real choice would be looking at the why, at the why and knowing who you are as a person. So often as a young person, you get very caught up in what it is you're going to do. Who am I going to be? What am I going to do? Am I going to be a PA? Am I going to be an actor? That's what I went through. Two, coming out, like, it's like who you are as sexual preference. Like I went through all that, and then you had to have another community, and who are you in that community? But you don't really fit in there. And it's like, you have all these I am statements that have nothing to do with who you are. So I'd say absolutely that's limiting social media would be a really great thing to do for this person. Social media, oh God, I mean, listen, we're on Facebook and Instagram. I love it, and it's got some good stuff to it, but you got to use it cautiously. There's a big thing for they say comparison. That's a big young adult thing to do. You're comparing yourself to other people. Do they make more money than me? Are they prettier than me? Do they have the family I don't have? The partner I don't have? The kids I don't have? Whatever. Comparative suffering. So there's comparative suffering, and then there's a quote, and I believe it's Maya Angelou, I could be wrong, is comparison is an act of violence against yourself.
I love
Like
that.
it's an act of violence against yourself. So I'd say absolutely you want to get to what is really causing that anxiety. Then there absolutely is treatment. So there's treatment for that to where you can do it over the counter to a little bit of benign propranolol into like the serotonergic drugs into like the panic attack. Panic attack is going to be more of a GABA and a GABA um not inhibitor but agonist, a GABA agonist like Xanax. And that's
Uh,
like last choice.
One thing I'll add for Teresa that's helped me is exercise
Yeah.
and nose breathing has really helped with
Yes.
my
Yes.
anxiety.
There's a really great study. Our buddy Zach Kramer is a breathing expert.
Yeah.
He said there's a study where they like people had their amygdalas messed with, like their fear centers. And the only thing that really got their nerves up, like they put them on the edges of cliffs, spiders in their face, their heart rate didn't change, they felt no fear until they turned down the oxygen in the room and turned up the carbon dioxide. They freaked out. So a lot of it is that nasal breathing can really help out too with calming.
I love this with good
Karen.
energy. Thank you, Karen.
Karen, when
That's
are we
cool.
taking another trip? We need another trip cross country. We need another transatlantic flight. Okay, we do.
Let's put this up here from Mark, my brother.
Mark.
Thoughts on venous reflux disease, chronic venous insufficiency, and inflammatory mediators with the Mark. You did it. IB.
So these are interleukins and tumor necrosis factors, TNF. So TNF alpha. So all this stuff is pro-inflammatory cytokines. So that's part of an inflammatory cascade that then can attack certain things. There's varying numbers of interleukins. IL-6, IL-8, IL-17, IL-20. A lot of the drugs that are biologic drugs decrease and block ILs, and you can look them up. And a lot of naturals like curcumin, turmeric, luteolin, quercetin also decrease those. So my thoughts on those, I have a lot of thoughts on those. Nothing specifically that comes to mind with their relationship specifically to venous reflux or chronic venous insufficiency, but I absolutely see the correlation that if you're having an inflammatory cascade specifically with these interleukins, that they can attack anything, and they can absolutely attack the vascular system too, because that's how all the stuff travels. So I absolutely see that being a causative agent, if not a supplementary agent to chronic venous insufficiency. Means that your veins don't move like they should. Your veins have valves in them that need to push blood where it needs to go. The hard part is that when you get into gravity dependent areas like your legs, it doesn't flow back like it should. So I absolutely see that can mess with those, which then the interleukins can absolutely mess with what your vascular system does, and it can't push back like it does. Actually, what Lucas and Ben Curtis, our Tri-Cities regional manager, they're having me do serapeptase and bromelain for my veins.
Yep.
And it's working. I love it. And two, even looking at just like decreasing the pressure by using compression stockings is another good thing too. But yeah, and I use low-dose naltrexone, which decreases interleukins and TNF factors as well. That's a great question. I'm sorry, it's not super specific. I don't have a specific answer about their actual relationship, but I can see absolutely where that tracks.
Mark, thank you for that question. I'm going to put
Mark,
this up
just
here
fix me.
Carter. I love this. Thank you, Carter, for this comment. If it's a young female and on birth control, looking into that being a root cause. Thank you for putting that in there, Carter.
Yeah, that's a good one. Yeah, absolutely. Because too, even we didn't even talk about that. Causative agents, are they on anything that's making them feel anxious? Birth control is hormones.
Real quick, let's get to this. This will be our last question from Frida. Frida's asking, Mom is 92, not active due to a fall a couple years ago, not eating very much, says not hungry, thinks she's eating, but she's not. How many calories a day does she need? Any thoughts on this? I know this is general.
That's a tough one. I'm sorry you're dealing with that, Frida. So too, usually like a basic calculation, if you're looking at a specific number, is going to be basal metabolic rate and total daily energy expenditure. If you look those up, you're going to find out exactly what she needs with age and weight. So it's basically basal metabolic rate is how much you burn, just you being you. How many calories? Total daily energy expenditure is how much you burn being you being you. So how active you are, how much muscle you have, all that stuff. So it will tell you kind of how much calories you need to eat to maintain weight, lose weight, or gain weight based on those numbers. And you can literally just plug them into the computer to do that. So we need to know kind of what her weight is in order to calculate those numbers. But a lot of it, if she's not super hungry and she's had falls and she's having cognitive decline or dysfunction, a lot of it is getting her to eat. That's a tough one. Sometimes people will use like CBD, sometimes even just like actual marijuana, THC can actually make you feel hungry. That's why people get the Ben, when you smoked a bunch of weed, what was it called? Munchies? I'm kidding. Ben never did that. Ben never did that. But too, THC and CBD absolutely can induce a hunger. It's almost like you're innovating ghrelin and CCK, which are your hunger hormones, instead of inducing leptin, which is your satiety hormone. And she thinks she eats when she doesn't. Oh, that's hard. That's a part of that cognitive decline. I would look at that for sure. Maybe I think CBD or THC would be totally worth it. But calories per day is going to be by total daily energy expenditure. So you can look at that. Anything to get her to drink calories is going to be easier to eat calories because those are going quick. So looking at stuff that's going to be Ensure shakes, anything that she can muscle down, and liquids are a little bit easier.
Frida, thank you so much for putting this in there for your mom. We hope that helps a little bit. Guys, that's going to do it for the questions. I see we're getting 10s already. How do we do real quick? You'll see that little thing at the bottom there. Free shipping coupon code is LiveQ. That is for our online vitamin store, performancemedicine.net/shop. If you're wanting to get some vitamins tonight, free shipping with the coupon code LiveQ. Let's see here if I'm missing anything. I think I got to all the questions. I want to put this up real quick for those who are.
Can you put up the two with Tom and Mark's comment? I know this lighting.
Where is it?
I'm so sorry. I am going to get a ring light.
Oh,
I
yeah,
am. And then put up Tom's too about the leg lamp energy. I'm going to get some lights. I am.
I love this. I'm
going to get a ring light. I promise. And I did get your note, Tom, about the bands, which is awesome.
Look at this.
So awesome.
I want to put this up from Tom because and he's taken our creatine and it's working for him. So I love this. Tom is taking the creatine.
Amazing. That's
amazing. On 10 pounds. That's amazing, man. Thank you, Tom, for putting this in there. Tom is he's at his peak right now at 42. I'm 39. I'm hoping to get there with you, brother. I love that. I love that.
This is such a good group today. I have to say, I talked Karen's ear off on a flight one time. Ben also did that recently. Okay.
I did.
I was just behind him on a flight and he was chatty Cathy with this guy. I was like, that guy must be so tired. I'm just kidding. I was like, who wouldn't want to talk to Ben? And so Karen and I had the best time. So yes, we did. We had an amazing time.
Ange, man, thank you for the time tonight.
Yeah, thanks, dude. This is great.
Guys, we appreciate y'all hanging out with us this evening. We do this every single Tuesday night, 7 to 8 p.m. answering
February is our month, Ben. It's our month. This is the month of Andy. You got 2 more weeks of me, and then I'm going to have to take a hiatus. I've talked too much, okay? And then what we call it? This is called B Team, and we're going to get A Team back in here with Papa B.
We got to get, Mark, Angie, we got to get your email right there, Ange. Thank you, Mark.
No, email to me again.
And then we got this from Michelle. Thank you, Michelle, a fellow Oak Ridger, 10 plus.
Yes. Oh, Armisted's gotta love them. Gotta love them. Yes, fellow Oak Ridgers. The Oak Ridge is in the house.
All right, Ange, I'm gonna let you go, man. Guys, thank y'all so much for hanging out with us this evening. I'm gonna hide this. And I'm going to see if there's anything else I need to put up. If you're a JC Aesthetics patient, we're doing specials on February 14th. You can see there, buy 2 chemical peels, get 1 free. A complimentary dermaplane with purchase of a Skinway, 15% off a Cool Peel CO2 laser. Go support our sister Kelly, Emily, and Kelly with a Y over there in JC. They do a wonderful job for us in the aesthetics department. Thank you guys for putting this in here. Must schedule by February 14th. Happy Valentine's Day to everyone in here and to
feel the love, baby.
Yeah. I love
Feel
it.
the love.
Look, thank you, Roel. Happy Valentine's Day back to you.
Thank you. Someone be my Valentine. Edna,
there's
will
my-
you be my Valentine?
There's my mama right there. So proud of you. I love it. Over the top 10.
Rush.
That's our mom.
So a shot in the arm.
Yeah, shot in the arm Thursdays. Thursday shot in the arm on Instagram. Come on, Mama Bear Meditations.
That's Mama Bear Meditations? A shot. Okay, I did not go there with that. I didn't know what that meant.
It's a new handle, but she does a shot in the arm. If you guys have seen it, Jenny J. Rogers.
No, I love
over
it.
there on
Mama
Instagram.
B, look at that face too. Can you zoom in on that face? She's stunning.
I love that. I love
Mama
that.
B
We love you, Mama.
Mama B, hot as ever. Okay,
And
Mama B.
we know Dad's watching.
Mom's gonna be my Valentine. Okay,
I love
Mom's
it.
gonna absolutely be my Valentine.
Yes,
Yes, I love it, Mom. Thank you.
I love you, brother. I'll see you here in a bit. Okay.
Okay, bye, y'all.
All right, Brad. Come on, Brad. Get my outro.
Don't go